I'm Hadiyah Charles, born and raised in St. Thomas, the capital of the Virgin Islands. Lots of my friends used to call me Commissioner of Questions because I always would be asking questions. And so, growing up in St. Thomas, we grew up in a very sheltered, very stable, very beautiful environment. And so I think that it's really shaped the person that I am today in terms of just being able to differentiate the differences between lifestyles, neighborhoods, environments. And so yeah, I consider myself blessed and lucky to have been raised in such a nurturing community. Right now, I have a huge focus on health policy. It became very apparent to me once I left St. Thomas and moved to the mainland that policy really had a lot to do with the way people live their lives. And so that's been the focus of my career for the last 10 or 12 years or so. Right? Everybody wonders, like, why would anybody want to work on HIV or Hep C? It's really, it really had to do with the numbers around HIV. When I started this work, women and teenagers were actually contracting HIV at very alarming rates. In fact, it was so alarming that it seemed like it would be a birthright for young women and girls, especially young women and girls of color. And so, as a person who had a finance background, I just couldn't understand why the numbers were so high for people of color when it was not that case for our white counterparts. And so, I just started to do basic research and then started to volunteer. And it was through volunteering that I actually was able to, secure a job in this field. And so that was really how I started to do hepatitis and HIV work. Just, working in the world of accounting and finance, it was just very, very mundane. So it was like, end of quarter, make sure you have everything balanced, give reports. And so I think that once I started to volunteer in the HIV field and work with women who were infected with HIV, it gave me a sense of purpose. And I think for, as a person who's single with no family, no kids, it really got to me at night when I would get home and think about, like, what did I do today? And it was like, oh, I just gave this report. Whereas when I went to volunteer, just being able to work with women and talk to them and know their story just felt like so much better. And I really wanted to do whatever I could to really help to improve the quality of their lives. And so, of course, when the job became available, it was a community organizer's position, one that was paying significantly less than what I was making at the time. And I really thought about it and decided that I would, change from numbers to people and do work that was really worth my time. And I've not regretted it since. I mean, even though, folks like my brother and friends will say to me, why are you doing this work? Like, who wants to work on HIV? Who wants to work on Hep C? Watch it before your name end up on somebody's housing project, But for me, it's not even about fame or glory around this, because it's really not anything to be like, proud of in terms of the situation that exists. But as long as I know that I was able to leave a legacy and to really work on policy initiatives that can improve lives. That's what's most important for me. So, just last week we had a meeting with one of Secretary Sebelius's counselors, Kaya Lewis, and in that meeting, really, it's about trying to make your issue one that's equally important to our federal partners. So when I go to DC, I can be meeting with members of the Appropriation Committee. I'd be meeting with members of HHS. And it's really all to really drive home the point of the particular disease state that I'm working on at the time. So hepatitis C, now there's a cure for it. And so we have, our government partners as well as industry partners and community, but we all need to work together. And so in order to just make sure we're all on the same page, we have to do meetings just to kind of really, portray the intensity and importance of it. And it really helps when we do meet with our partners on the federal level. So I've been doing work, of course, on the HIV, issue as it related to women and girls. And in 2011, I was nominated as a champion of change as part of the President Obama's Winning the Future initiative. And prior to that, I'd been invited to do panels at the White House, and since then I've been invited to consult on issues around HIV and hepatitis C, but more so around HIV. So it was good. I mean, oftentimes, like I said, we do this work, it's really thankless. We're doing it on behalf of people who could care less, kind of, in terms of, the everyday, today policy. And so it felt really good to be able to be recognized by President Obama. And recently I was recognized by the CDC Foundation. So it's good because you're able to get that recognition and feel as though you are doing something that's going to impact change. So yeah, I've been doing great work, and I'm glad that people are recognizing it. I think there are lots of organizations in the territory that are doing really significant work on HIV, especially in terms of education and testing. And I think just, the same in the territory as well as on the mainland. People really just need to be aware of their sexual health, know their status when it comes to sexually transmitted infections, know your HIV status. Once people start to get used to even going to the doctor to make sure that they are overall well, that really, really helps once you build up a routine of taking care of yourself. So, growing up, I would always hear about my great-grandfather, Joseph Gomez. I'd pass the school and see his name. And so I think for me, a lot of what I'm doing has to do with the family. The Gomez family, our lineage, and who we were. I know he was part of the Unity Party back in St. Thomas in like the way back when. But in any case, he did a significant amount, enough to have impacted change and be acknowledged for it. And I think that, what drives me is wanting to make my mom proud, my brother and my father, but also people that came before me, so like my great-grandfather, Joseph Gomez. And ideally the work that I'm doing here in New York and across the nation as it relates to health policy, I'd love to one day be able to go home and use the skill sets that I have in order to really benefit our entire territory. And so, that's really my driving force, like my family, especially my mom, my dad, and my brother. But when I think about, the history and legacy that the Gomez people have really had in St. Thomas and the Virgin Islands, that's what keeps me going.